On any given day, almost 11 million people are held in prisons or other closed settings. COVID-19 poses an extraordinary risk to people in prisons, for whom physical distancing is not always an option, and who often have a weaker health profile than people in the general population. Overcrowding, poor hygiene, ventilation, and nutrition, coupled with insufficient healthcare services in many prison systems, significantly increase the risk of transmission of HIV, TB, viral hepatitis, and COVID-19. The United Nations Standard Minimum Rules for the Treatment of Prisoners, also known as the Nelson Mandela Rules, state that people in prison should enjoy the same standards of healthcare as those in the community. Evidence-based COVID-19 prevention and control measures are urgently needed in prisons and other closed settings. These measures should be implemented in full compliance with the Nelson Mandela Rules and other international standards in order to protect people in and outside of prison. Together, UNODC and other UN entities are developing and disseminating technical guidance for COVID-19 in prison settings, providing technical support in developing and implementing national action plans in prisons, providing personal protective equipment for prisons, and capacity building for policymakers, prison authorities, and staff.
The agencies came together to articulate some pillars of work around, try to make it practical. And again, it's not new. We've always called for reducing overcrowding, ensuring health and safety and human dignity, ensuring access to continuous health services, respect for human rights. Talk to the prisoner. They will help you design services and programs that make sense and they work. It's not just about health. It's also about sexual and reproductive health and rights. It's about human rights, about social support, mental health, and so on. So engaging with the prisoners will help us move faster, and it will help making sure that whatever we design is acceptable and accessible.
Prisons and other custodial settings should be an integral part of public health response to the COVID-19. Now, realizing that WHO has put together an interim guidance to really support member states to prepare the response in prisons and other areas or places of detention. Now, this guideline was released in mid-March this year on preparedness, prevention, and control of COVID-19 in prisons and other places of detention. Prisons overcrowding should be addressed, which is a really big issue in many of our settings.
But as part of the United Nations principle of ensuring that we leave no one behind, this is really was a call to underscore that we don't forget those who are left behind bars. Some of the calls to action, if I can put it that way, have been around the release of those that are most vulnerable to COVID-19, older persons, those who are sick, as well as low-risk offenders. They should also be continued provision of healthcare requirements, in particular for women prisoners as well. We are beginning to see that there are particular needs of women in prison settings, those who are pregnant, as well as those inmates that might be persons with disabilities or juvenile detainees. And all of this really is intended to ensure adherence with the Nelson Mandela Rules, as well as other international standards.
Prisons in many countries are isolated from the public health system, and this is why our position paper is calling for two major things. Number one, trying to reduce the prison population by reducing the number of people admitted to prisons, through alternative to pretrial detention, alternative to incarceration, also promoting that reducing the number of the people in prisons according to the national context by release pardons without compromising on the public health and safety. And upon release, it's also very important to make sure that people released from prisons are connected and linked to the community healthcare facilities. This is very important to ensure the continuity of care. People released from prisons should be connected to the community health facilities to ensure that we continue these services, whether it's HIV, TB, or other healthcare services that they may need. All of us, we would like to acknowledge the people working in prisons and as part of the workforce, especially healthcare providers doing a great job providing all the necessary health for people in prison and ensuring prison health as public health.
In responding to COVID-19 in prison settings, we must ensure access to continued health services for people living with HIV, TB, and viral hepatitis. We need to embrace universal health coverage where prisons are integrated into community healthcare services. Prison health is public health.